am.
This meeting is being recorded.
Right, the meeting is being recorded, which is great because we're going to probably post this on the Office of Equity and Civil Rights website at some point so people can come back and check. But anyway, I am Dana Moore. I am Baltimore City's first ever Chief Equity Officer and the Director of the Office of Equity and Civil Rights. We are happy to have so many of you here for our, I call it a town hall meeting, for our discussion in honor of Black History Month with the theme of, oh gosh, already I'm befuddled, Black health and wellness. So this is being sponsored by the Office of Equity and Civil Rights and the Office of the Chief Equity Officer. There are so many people that I'm going to get to the introductions in a minute, but I really want to thank the staff of the Office of Equity and Civil Rights for putting this together. John Wesley, who is our Public Information Officer, Karan Watkins, who is the Assistant Chief Equity Officer for the City of Baltimore, Jill Muth, who is actually, let's think really good thoughts for Jill. She's a law student and she's in class tonight. And I think she might even have an exam. So we want to really think good thoughts for her. And Deputy Director Kaylin Young, who I believe is on, but I don't see him. We are also joined by 4 very, very special guests. If you don't know her yet, you will absolutely know her well after tonight. Dr. Kendra McDow is Baltimore's Chief Medical Officer. And when we flip over and she does her introductions, I'm going to have her explain the difference between the Chief Medical Officer and the Health Commissioner, because there's a big difference. We're also joined by Coach Chauncey Whitehead. He is the owner of CDW Fitness. And I see lawyer legend on here, Eddie Smith, and he would want me to tell you and give full disclosure in the spirit of integrity and honesty and full transparency that Coach Whitehead is my coach. He is the one that I go to for those fitness honesty checks when he says, you need to get back in here. So that is Coach Whitehead. Richard Rowe is on, and I guess also, and I see my husband is on, and in full disclosure there, we consider Richard Rowe a family friend of long standing. Richard is with the, yes, with the Black Mental Health Alliance. He's been in that work for a long time. He has a lot to share with us about our mental health, especially in this unique time. Dr. Daniel Cumming is a historian, and he's also a postdoctoral fellow with the, and it's a little long, the program in racism, integration, and citizenship at Johns Hopkins University. So welcome our guests. Thank you, Office of Equity and Civil Rights. When we were doing all our planning for this, we kept saying, people are going to need to have pencil and paper to write down notes on this, because you're going to get a lot of information. So if anybody needs to take a pause already to go get a piece of paper or maybe a couple sheets of paper and a pen, please do so. You're about to get a lot of information, valuable. So why are we here tonight? As I said in the introduction, we're here overall observing Black History Month. And they do have a national theme for 2022, which is Black health and wellness. And we just loved that theme because it brings in, and as Black folks, it brings in not just our family doctors that we've had since we were kids. And it's not just the doctors in our family. It brings in the osteopathic medicine, homeopathic medicine, holistic health, birth workers, doulas, midwives. We still have relatives and family and friends who were born at home because they couldn't access a hospital. Midwives, naturopaths, herbalists, and others who promote health and wellness among African-American people. For a time, my family lived in Topeka, Kansas, and castor oil was a staple. Herbs were a staple. You know, you got a little cut, you got a poultice that you put on to help you heal. So there are a lot of home remedies that we as Black folks have used, but we've also, you know, grown up in a system where we had to take care of ourselves and fend for ourselves. We grew up in a society that was racist and it was exclusionary. So one of the things in getting ready for today, I did a, oh gosh, I don't know if I can find it, did a little timeline of when certain things happened. And I'm going to go to Dr. McDow first. In 1793, the Baltimore City was the first city to establish a health department. In 1828, and we always talk about the Oblate Sisters of Oblate Sisters of Providence and St. Francis Academy, because that for us, for my family, is a real central hub of a lot of what was happening in and around Baltimore. So in 1828, St. Francis Academy was opened, and that was the first school dedicated to educating African-American children, children of color. In 1889, Dr. Cumming, Johns Hopkins Hospital was completed. And then in 1894, Providence Hospital opened. So I want to step over, and when I did the timeline, I found it interesting. Hopkins Hospital opens in 1889. 5 years later, Providence Hospital opened. And that was the first Black-owned hospital in the country. So there's a lot of why of that. First, let's go to Dr. McDow and just talk a little bit, just tell us a little bit about yourself and what led you to go into medicine and public health in general. And then let's talk about Baltimore's history as the first place, the first city to have a health department. Dr. McDow.
Yes, thank you so much, Director Moore, for the invite to be on this talk today. My name is Dr. Kendra McDow. I'm the Chief Medical Officer of the Baltimore City Health Department. I am also a pediatrician. I trained at the University of Maryland pediatric residency program, and also have my master's in public health and worked for the CDC for a little bit before I came to Baltimore City Health Department, and then also worked as a pediatrician at a federally qualified health center in Silver Spring, Maryland. I know Director Moore wanted me to go into detail a little bit about the difference between the Chief Medical Officer and the Commissioner. So the Commissioner of our health department, as mentioned, the oldest continuously running health department in the nation, is Dr. Letitia Jaraza, who's also the first African-American woman to lead our health department and is also a pediatrician. Dr. Jaraza is the head physician for the city of Baltimore, and she leads through strategic vision and implementation, the health and the direction of Baltimore City in regards to health and health policy, and then also leads the Baltimore City Health Department and that strategic vision itself, and also the employees. So she is our chief physician in charge for the city. As the Chief Medical Officer, I am an advisor to the Commissioner. I am also an advisor to the multiple programs throughout the health department, providing that medical consultation, providing technical assistance, advice, making sure that all of our decisions are medically sound. My work also is involved with programmatic work as well. So also running the city's local health improvement coalition, which is a cross-sectoral collaboration and coalition of healthcare, I don't want to use the word stakeholders, but key organizations in healthcare, community organizations, community members, and then of course to our larger acute care hospitals as well. And then also we do work around our accountable health community. So as we get some more time to talk about disparities, inequity in health outcomes, we can talk a little bit more about some of the programs and the vision of Dr. Jaraza and her mission to improve health outcomes for Baltimore City residents.
Great, thank you so much. And I just want all of our listeners to know about the great work that you do. And I know we're going to get a little bit into the disparities a little bit later, but right now I really want people to understand that a lot of the health policy and decisions and practices that we're experiencing now because of COVID, Dr. McDow is a key player in informing the mayor and city leadership about the decisions that need to be made and that have been made to keep Baltimore safe. Just a little plug, it cannot be said long enough, loud enough, clearly enough that Baltimore is a leader in really responding to the COVID pandemic. And a lot of that is because of the brilliance and the sacrifice and the fortitude of Dr. McDow. So thank you, Dr. McDow, for that. Turning to Dr. Cumming, so we talked about Baltimore being the first city to have, or the longest surviving health department. Baltimore is also uniquely situated because we're the first city to hold a Black-owned hospital. So after you just provide a little bit about your background, I want to jump right into a little bit of the history of Provident Hospital and its importance in Baltimore's health history for Black people.
Yeah, thank you so much. First of all, I'm honored to be here. And again, thank you for this invitation. This is an exciting panel to be a part of, and I truly appreciate the opportunity to talk about some of my research. Just to be brief, I am a postdoctoral fellow at Johns Hopkins. I started this fall. I will be here for several years. I'm working with the History Department and the Africana Studies Department, and I'm placed in the program in Racism, Immigration, and Citizenship. So we're in the middle of what's called Inheritance Baltimore, which is a nationally funded project to connect community stakeholders to the university and try to bridge some of these walls that have grown between the two. So keep an eye and ear out for some programming that will be coming up this spring, as well over the next couple of years through Inheritance Baltimore. And I will be a part of that. My scholarship really looks at the intersections of housing policy, healthcare, environmental justice, racial capitalism, and metropolitan history in Baltimore City in particular. I wrote my dissertation on Baltimore, titled Health is Wealth, the Rise of the Medical Metropolis and the Remaking of Racial Inequality in 20th Century Baltimore. And what I really strive to do in this work is trace the rise of Johns Hopkins medical institutions, but also the larger political and economic growth model of meds and eds, some of us may be familiar with, and I can talk more about. And really looking at that transformation in East Baltimore and studying how housing, labor, and environmental exploitation created new forms of social precarity in the deindustrializing metropolis, especially among African Americans who lived in East Baltimore, who often worked at Hopkins, and were subject to decades and really kind of generations of displacement and, as I can talk more about later, some of the labor issues, churning through that institution in that part of the city within the expanding care sector. So Provident Hospital is a big part of my research and a big part of my story. And I think of interest to everybody here because it was really, as mentioned, it was founded in 1894 and the first in the country of Black-owned community hospitals, voluntary nonprofit, started by several physicians who moved to the city after receiving their medical education. This is Dr. William T. Carr, Dr. J. Marcus Cargill, Dr. William H. Thompson, and they formed a nucleus that became the Board of Trustees of this fledgling hospital, which was really kind of on the cusp of a national movement for Black health in the post-Reconstruction South, but also the North, such as Chicago, and some of the hybrid cities such as Baltimore. It was located on 419 Orchard Street. It was 10 beds in total. And it really survived in these early years through donations from churches, from women's club groups such as the Auxiliary of Provident, from Black businesses such as the Afro-American, led by the storied folks who were going through Douglas High School as principals or teachers. And again, some of the real prominent leaders of the Black community in the early 20th century. Now, Provident was incredibly important at this moment because it was an anchor institution during Jim Crow, where Black folks were denied access almost across the board. And if they weren't denied access full stop at the door, then they were treated in segregated wards, which were often understaffed, neglected, and in most instances abandoned. Provident Hospital was located on the Lung Block, which I can talk more about, but this was a infamous city block that was known for incredibly high rates of tuberculosis, which was at that time a real scourge within the city, but particularly among African Americans. The death rate was about 4 times that of white Baltimoreans. And by the 1930s, one of the worst death rates in the country due to tuberculosis. But based on that location and based on that deep community involvement, Provident Hospital was really able to respond to community needs in a way that predominantly white institutions were not interested in doing at the time. It had one of the highest occupancy rates of any city hospital for much of its history, which is nearly 100-year-old history. And it was really kind of a center for professional training among physicians, nurses, and a community employer, about 1,000 workers by the 1980s. Okay, I can stop right there. I can talk more about it as well.
No, that's fascinating. And I guess that's kind of where I jump in and begin my relationship with Provident Hospital. I just want to share with everyone that when I started posting on social media and doing teasers, the one that really got the interest of a lot of people was about Provident Hospital, and not just how it began and its importance, but why it didn't continue on. And so maybe just just a couple thoughts about that. My husband is on Ralph Moore, and I didn't know this, but he shared that he was on one of the last boards of trustees for the hospital. And I think that must have been before I met him, because we never talked about it. But anyway, could you just talk a little bit about why it didn't continue on? And then we're going to circle back around. I'm going to get over to Dr. Whitehead, Coach Whitehead.
Yeah, absolutely. This is a really long and storied history. It's almost a 100-year institution, 1894 to 1986, when it merged with Lutheran Hospital and became Liberty Medical Center, before finally shuttering its doors in 1999, I believe it was. So the reasons are pretty complicated and varied, but I want to draw everyone's attention to the 1970s, when Provident Hospital moved up out of West Baltimore, old West Baltimore, where it was located on Division Street at the time, into a brand new, incredibly modern facility on Liberty Heights. And this was a 6-story building. It had, I think, roughly 273 beds, if I'm not mistaken. It was the first all-electric hospital in the country, a source of immense pride with graduating classes of nurses since 1929, and really a national reputation in quality care and professional respect. It was equipped with all the most modern equipment, such as x-rays, lung machines. It's able to develop community outreach programs that were pioneering in so many ways, including comprehensive mental health care, heart and lung facilities, drug and alcohol addiction, mobile units for education and public health. I mean, truly amazing. And we can talk about all the layers to it. But one of the reasons why it started to undergo some of the financial troubles that led to its merger in 1986 were due to its history of Jim Crow healthcare provision, which added an incredible amount of financial strain to the hospital's operating budget, one in which there was almost constant fundraisers for just to meet the operating budget. And as it expanded, an increasing amount of local and state debt was absorbed too, as really kind of part of a compromise with predominantly white institutions that did not want to open their doors to a lower income Black patient base. And so as these financial struggles compounded, the hospital went into state receivership in the early 1970s, was able to reorganize and pull itself out. But then by the 1980s, there were a series of just deeply entrenched fiscal problems, that can really be tied back to this debt burden, and as well as some labor unrest with nurses who demanded a living wage, rightly so, as many of them were underpaid compared to other hospitals and institutions. There was a physician's boycott in 1984, also due to some of the administrative challenges with running a hospital that was always close to, if not threatening, falling underwater and going into threat of, if not state seizure, even bankruptcy. So really, there are a lot of different ties here that came together. But by 1986, the pressures were just too much. The budgets were not being met. There's an incredible amount of debt on the ledger. And the only option really at that point was to consider a merger with another West Baltimore institution, that being Liberty Hospital. Unfortunately, that merger was an incredibly painful process. I've interviewed folks who've been part of that, and it sounds like we have some members here too who've experienced that firsthand. But they had to deliver, the institution had to declare Chapter 11 bankruptcy in spring of 1985. And with that merger, Liberty Medical Center Lutheran really was able to purchase Liberty Heights facility, move in, rename it Liberty Medical Center. Provident found itself with only 4 of 18 director seats through this merger. About 400 Provident Hospital workers were fired. And then to add insult to injury, Liberty Hospital security searched many of the Provident Hospital workers on their way out. The assumption being that these workers would steal things and take it with them.
Yeah.
So just incredibly difficult period and incredibly difficult history as this merger went through, and really a storied Black community institution was absorbed into a predominantly white institution that then, according to a lot of people at the time, worked pretty efficiently to strip it of that history.
Yeah, it's a challenging history to say the least, and a multi-layered cause and effect. So thank you for sharing that. And we'll come back to it. Before I go to Coach Whitehead, I just want to acknowledge City Councilwoman Danielle McCrae has joined us, and it's always great when we have the support and the participation of the City Council. Danielle McCrae is one of our newer members of the City Council, but if you read today's paper, she is a leader and is making her mark, and she has advanced some legislation that I think is just an incredibly strong and positive response to one of the greatest tragedies our city has experienced, and that is the loss of 3 firefighters and the injury of a 4th. And it's all about solutions. So thank you, Councilwoman McCrae, for your leadership. And leadership, it comes in all forms. I think I saw a number of my colleagues or my compatriots with CDW Fitness. Coach Whitehead, our coach, has been working in the field in this industry, making sure we're all healthy and fit for many, many years. I'm going to let him introduce himself, and then I want to ask just a few questions about fitness and how that all fits in with what we can do ourselves to help ourselves. So, Coach Whitehead.
Good evening, everyone. I'd like to thank you, Director Moore, you and your office for inviting me on this wonderful panel. Some of you may know me as Chauncey the trainer, and some of you may know me as Chauncey the fitness activist because of my willingness over the last 20 years to meet the community where they're at. I believe in a no-nonsense fitness structure, some of the old school things to keep us moving, to keep us grooving a little bit. During this pandemic, we have found that some of the basics of fitness, outdoors, jumping jacks, walking, moving, can keep us moving because we really don't have the financial means, and some of us don't have the ability to get to some of the gyms. So what I do, I try to bring the gym to you. And I just want to tell everyone on this call tonight that if you need someone to work with you, you need someone to walk with you, you need someone to hold your hand through this fitness experiment and through this fitness movement, just give me a call, reach out to Director Moore, and I'll be more than happy to work with you.
And he really does mean that. And I know, Coach Whitehead, that you're not doing this work because of the money. You're doing this work because you believe that Black people, brown people, all people have the ability to help themselves in terms of fitness. Can you talk a little bit about your Sunday walks that you do through Druid Hill Park? And it would be really great for people to hear how that started. And I think you've done the 101st or the 102nd consecutive Sunday walk. So we could talk about that.
Well, what we decided to do, like everyone else back in, I think it was March of 2020, we didn't know what was going on. I didn't have a clue. The country shut down. I never remember the country shutting down. So I decided to walk. That's what I did. I decided to walk on that Sunday. I walked, and then my client and my friend and my former Mayor Sheila Dixon, she began to walk with me. Then the next thing you know, a couple other people began to walk, and it became the must-do, must-see event every Sunday to keep us grounded, to keep us moving with fitness. And so now here we are. In 2 weeks, we'll be celebrating our 2-year anniversary of walking every Sunday since the shutdown. And walking is the easiest form of exercise. It's the cheapest. And you never know, you just might make a friend along the way while you're getting healthy. So we've been walking for 2 years, and I encourage all the listeners on here, if you want to come and walk with us every Sunday, 7:30 a.m., rain, sleet, snow, or shine, we show up to walk and talk. My motto is a community that walks together, talks together. So you'll learn a lot about one another, and you'll learn a lot about how to help the community by listening to the community.
So thank you very much. One of the things that, the parallels is we have the structured medical groups, we have the physicians, the hospitals, the story of Providence Hospital not sticking around there's tragedy in there. It's tragic in many, many ways. And then the parallel, Coach Whitehead, your ability to bring people together, and collectively, but to also give people the tools to maintain their fitness and health on their own is, it's an incredible story. So thank you for sharing that. Richard Rowe, sure. Black Mental Health Alliance. I think that, one, I want you to introduce yourself in a little more detail, and then talk a little bit about the Black Mental Health Alliance. And then let's, spend a few minutes talking about mental health and how, we've all been impacted because of the COVID pandemic and the isolation that comes with it. So Richard Rowe.
Okay, hopefully I am off mute. I think I took myself off. I sometimes don't do that. But thank you, Dana, and your office for the invitation. And thank everyone out there who is listening to us this evening. I can't go too far without thanking and at least acknowledging my relationship to 3 powerful brothers of mine on this call. Ralph Moore, of course, related to Dana Moore. That's a dynamic duo in and of itself, and I could talk all day about that dynamic duo. But Ralph and I go way back, and we at one time headed up one of the largest mentoring programs for Black youth in Baltimore, in the country, some years ago, Project Raise. And we had hundreds of young people basically trying to address their overall spiritual, psychological, physical health through mentorship and programs like that. So Ralph and I go back a long way, and we have maintained that relationship. That's why Dana said I'm part of the family, because I am. And Ralph is one of my esteemed brothers, and can't go so far without mentioning John Milton Wesley, also a powerful brother and friend of mine who has done remarkable work for a long time. And so we have a very good relationship. So John, thank you for all the work that you do and have done. And of course, Chauncey, we don't know each other that well, but I look at you as an esteemed brother of mine who has been instrumental in making certain that we spend time on addressing our overall health. Long before it became popular, and you not only talk the talk, but you walk the walk. And to anyone else I miss on this webinar, please forgive me. but I know I have friends out there, and I'm still your friend, even though I didn't mention your name, but just know I care about you and appreciate the work that you and everyone else on this call is doing in this space of equity and justice and so forth. Black Mental Health Alliance, I am Richard Rowe again, and I just have a long history of working in this space of simply trying to elevate and speak to the overall mental health and well-being of our people. The Black Mental Health Alliance is interesting. When I was listening to the doctor talk about the history of this town and hospitals and so forth, you know, Dr. Maxie T. Collier was one of the first Black and was the first Black health commissioner of the Baltimore City Health Department a number of years under Mayor Kurt Smoke at the time. And I worked with him and under him. And that, as a result of my work with him, he and Delegate Shirley Pulliam and Figner Warneth, a social worker, Delegate Pulliam, a nurse, thought it was critical to form an organization or entity that would look at mental health and well-being, address stigma, address the cultural competency, cultural and linguistic competency of mental health professionals, so that if we were going to them, they understood, they respected, they valued our humanity. And so this organization has been around now for 37, 38 years, you all, doing this work, training, advocating for, working with others, lifting up, speaking to the significance of our well-being. You know, Zora Neale Hurston once said, if you're quiet about your mental health, they will hurt you, harm you, and make you think you enjoyed it. That's not a verbatim quote, but that's where she was going with that. And so Zora Neale Hurston is one of my favorite writers and so forth. So again, this organization has been trying to do critical work for children, Black women, Black men, Black families, Black communities around this very critical and very important understanding of who we are, why our mental health is so important, why we are deserving of well-being, because for a long time, that was something that we were taught not to be concerned about. You know, how dare you be concerned about your mental health and your well-being? So we developed stigma. I mean, a stigma was attached to going to get help, addressing our mental health and well-being, talking about it, talking through it. We spent a lot of time basically feeling that we, you know, should experience pain, that we should experience suffering and go through all this on our own, by ourselves, et cetera. So we've been at this work for a long time, trying to address that. Now, real quick, let me mention because this is Black History Month, and I would be remiss if I didn't mention one of my heroes of history, Dr. W.B. Du Bois. Some of what he spoke about in his seminal work, The Souls of Black Folks, was critical in terms of why we need to really address our mental health and well-being. This quote, and I won't quote the whole thing, but this quote is critical, you all, because it written in 1903, think about this. And he said then that, you know, our sense of always looking at oneself through the eyes of others and how their self-perception is heavily influenced by the white majority's perception of them. One ever feels this two-ness, an American, a Negro, two souls, two thoughts, two unreconciled strivings, two warring ideals in one dark body whose strength alone keeps it from being torn asunder. And we could unpack this quote and speak to mental health and well-being. We could speak to inequities in the health field. We could speak to microaggressions, macroaggressions. We could speak to implicit, explicit bias. We could speak to all of those things, systemic racism, structural racism, so forth and so on, and how all of those isms have collided on historically and even on a contemporary front, and basically has caused us to be at war with ourselves and to be at war with each other. And so until we address our overall psychological health, our emotional health, our spiritual health, it's going to be very difficult to address any other aspects of our health. And so that's our work. That's where I've been for quite some time. I've been other places, Sojourner Douglas College, Associated Black Charities. I've been doing a lot of work primarily for our people, not primarily, but primarily for our people in areas of family, enriching families, working with parents, working with Black men and boys, doing a lot of that work, advocating for, speaking on behalf of, writing, teaching, et cetera, et cetera. So that's a little bit about me. But again, our mental health is critical. Black Mental Health Alliance is an organization that's been around for quite some time. We're on the web, we have a website, social media platforms, and so you can find out more about our work, our trainings. We've been doing a lot of training of professionals, trainings of parents and men and women and young people. So our new executive director for the past 2 years, she came on right in the midst of the pandemic. Andrea Brown is our executive director, and our board chairperson is Dr. Jonathan Shepard, who is also a psychiatrist. But I just wanted to lift up some of these folks, lift up Dr. Maxie T. Collier, who was a preeminent psychiatrist and who taught me so much. And sorry, we lost him early in his life, unfortunately, but he wrote an excellent book called Phoenix Arising. And if you want to know about this brilliant, genius level thought leader and psychiatrist, Dr. Maxie Collier, you can pick up a copy of his book. So sorry I took long to introduce.
No, this is perfect. This is perfect. And Dr. Henderson, Lauren Henderson is on. And if you guys, she's waving, if you would please check the chat. She's dropped in a lot of really important information. And Richard, before I move on, I'm just asking if someone could put into the chat the suicide prevention hotline number. I should have thought to do that myself. We are seeing a great increase in the incidence of suicide and attempted suicides. We know that the isolation is an indicator for that, and we're experiencing so much of that now because of COVID. Dr. Henderson also dropped in, I think, the wording of the quote, which is one of my favorites from Zora Neale Hurston, and it reads, "If you are silent about your pain, they'll kill you and say you enjoyed it."
Thank you.
And that's something that we as Black and Brown people really need to think about. We are empowered to speak out, about our pain and what's bothering us and what our concerns are. And so, truly, if someone, finds that hotline number, yes, we will. Thank you. I think that might've been Karan. Thank you so much. And no shame in using it. The only shame is in not using it. And Richard, you talk a lot about the challenges of being Black and navigating our world. And Dr. McDow, we are still in Baltimore. There's a saying that your zip code can kind of dictate your health. It can dictate your future. Hotline number 1-800-273-8255. That's in the chat. So I want to turn to you, Dr. McDow, and talk a little bit about the health disparities that we're experiencing still in Baltimore and what the health department is doing to address those disparities.
Yes. So first off, I do want to go back to Providence Hospital and link that, when we talk about health disparities, health inequity, particularly in the Black community, we also need to talk about healthcare workers and physicians. And so, I'll get to your question, Commissioner Moore, but I really wanted to make this point that I don't remember, I think in the early 1900s, there were Black colleges of medicine, there were Black schools of medicine that were training physicians, that were training midwives, that were training nurses, and our Black hospitals were also a training ground for a Black medical workforce. And what we saw, there's something called the Flexner Report, which basically came out and said that these specific schools were providing inadequate education. And so we saw after this Flexner report, the Black colleges of medicine close. And we saw, as a result of that, also a decrease in the number of African Americans that were being trained in medicine. And so a training ground like Providence Hospital leads to physicians, leads to nurses that are African American, that know the community, and that bring a unique perspective. We know that the data. So the data shows, especially in the pediatric population, that if a newborn is Black and is taken care of by an African American pediatrician, that child has a higher likelihood of survival during that newborn period. And we know that there is racism and discrimination among physicians. This is real. And so I know that there was, so I just wanted to point that as well, because the pipeline, the pipeline goes all the way back to Providence Hospital. And this leads to the disparities that we're seeing also in regards to neighborhood and place, because you do not have quality healthcare, you do not have physicians that look like the community in those spaces and serving those communities, which can lead to disparate health outcomes and disparate care. So just wanted to make that connection as well. I also do want to highlight that, yes, the Baltimore City Health Department has been a contributor historically to health disparities in Baltimore City. That you can read the Black Butterfly by Lawrence T. Brown. He actually came to speak last week at the health department. And the commissioners prior, I can't name them all, but used data to displace Black communities.
True.
Leading to neighborhood segregation. So these are deeply entrenched. We are the longest running health department in the nation. So this is deeply entrenched. And what the health department is doing from a very strategic level is, one, learning about how we contributed to these health disparities, how we contributed to the mistrust in the community. And then also, so that education is very, very important. And then through your office, the Office of Health Equity, we have been doing work to look internally and also externally around how inequities are perpetuated through systems that we have in the health department. Internally, I'm talking about systems around our processes and how we relate to employees. And then, of course, externally, in regards to the health department, how we look at policies, how we look at programs and how we interact with our community partners. Just one quick example of how we are looking to focus on place. And using place and neighborhoods as a way to focus on specific interventions. Through the vaccination work and also through our testing work as well, in response to the COVID-19 pandemic, and working with various partners, community organizations, of course, our FQHCs, our churches, our faith-based organizations, our acute care hospitals. We use something called the value communities model to specifically focus on populations, on communities that we know have been disproportionately impacted by COVID-19, because those are the communities that are going to need specific resources. And it cannot just be a blanket response, but it has to be specific and tailored to that group. There are 9 communities overall, and we focus are focusing our outreach on areas with low vaccination coverage. And actually, if you go online, our dashboard, our vaccine dashboard at coronavirus.baltimorecity.gov, you can see a map. And that map shows by neighborhood vaccination coverage area, vaccination coverage. And you will see that vaccination clinics are specifically in neighborhoods with lower vaccination coverage, and outreach is taking place across the city in those neighborhoods. But if you take that map and you overlay it on the map of life expectancy, of infant mortality, of cardiovascular disease prevalence, you will see that these maps line up. So it's just an illustration of that neighborhood, the neighborhood disparity that we're seeing in regards to health outcomes. And so what the health department is doing, we're utilizing a strategy, a health in all policy strategy, and also focusing our policies, focusing our guidance and our programs across the board to really look at racism as a public health issue. And so that our vaccination work is just one example of that. Be More for Healthy Babies is an excellent example of when you focus on the communities of need, when we really focus about equity, moving resources, people, staff, financial resources to those communities, that you can see a change. And we've seen that in terms of infant mortality across Baltimore City from the work for Be More for Healthy Babies.
Yeah, thank you. One of the things I've heard Mayor Scott say this, I know I embrace it. We talk about this often until we actually stand up and recognize out loud that we as a entity, as a government, as society have had a role in a lot of the health disparities and the overt racism. We're not going to be able to get beyond it. And frankly, I'm not sure we're ever going to get beyond it. But we can't address these challenges if we don't acknowledge not only that they exist, but that we had a role in their coming to be and their being sustained. And so Dr. Cumming, what Dr. McDow has just shared really highlights not just the importance of Providence Hospital and Liberty Medical Center, but how impactful the loss of that hospital was. And I think that we're still experiencing, that impact. There's a couple questions in the chat, and before we go to those questions, I want to make sure I get an answer to this question from each of you. And I'm going to start with Coach Whitehead. And it's a simple question, but might have different answers. And here it is. And I think never mind. What will be the long-term impact of COVID on America's healthcare system around Baltimore City from a fitness perspective?
From a fitness perspective, I believe the long-term effect from COVID would be individuals that would probably have cardiovascular issues, individuals that would probably have other fitness related and even medical related issues going on because of the sedentary lifestyle due to COVID. So there's just a whole bunch of things that are probably going to come because of COVID over the next 10 years with the term long COVID, even as relates to a fitness perspective.
Mm-hmm. Right. Thank you. For me, and I don't even know if I've ever shared this with my husband, but I always feel like every day I'm trying to outrun COVID, that I'm trying to get ahead of it, that, we know that obesity and people with comorbidities are more subject to succumb. And so I'm, just trying to always get ahead of it. And so I think I like to think I'm on the other side of, the sedentary life. And I guess the deliverable is that we can all do something. Wouldn't you agree? We can all do something.
Absolutely, Director Moore. We all can do something. And that's why I believe in meeting the community and meeting the individual where they're at, especially during this pandemic, to go back to the basics of walking, walking and doing just some type of physical exercise, some type of physical movement that doesn't cost much, and you don't need equipment, because the walking is going to help us in this long term during this COVID pandemic.
Great. Yeah. Dr. Cumming, what would you say is going to be will be the long-term impact of COVID on America's healthcare system?
This is hard to answer as a historian. I am still often looking.
You've got like 2 minutes to do it.
Yes, perfect. One thing I want to just mention, and perhaps build on the point that Dr. McDow is making, was really thinking about COVID, thinking about the contemporary moment. We have to think about our healthcare workers and the incredible tax that the pandemic has put on our healthcare workers and our institutions. I think we all know folks who are working there, if not ourselves, and the incredible stress that that people are going through is something that we need to put foremost as we're thinking about how we are going to, build our way out of this pandemic in hopefully a sustainable and just manner. And it also brings up for me as a historian, sort of the city's history of suppressing workers and healthcare workers in particular, going all the way back to the 1969 Union Power, Soul Power movement, building on a history of 1199, later SEIU, healthcare workers who are often fighting for living wages, and some of the institutions in which they're working are those institutions who are the greatest obstacle. So I really want to kind of put that history foremost, and really keep in mind who is doing the work of saving us in the middle of a pandemic, and then also bring it full circle as a historian to some of the vaccine trials and Henrietta Lacks's cells, who were really part of finding a vaccine that could be rolled out nationally, and thinking about questions of where medical knowledge comes from, who produces that knowledge, and the deep ethical histories of consent that are oftentimes not part of that, especially within the Black community. But I hope that turns a conversation towards broader questions about reparative justice, and really kind of thinking about reparations as a very serious mode of politics when we're thinking about where we are right now and where we want to be, especially in a city like Baltimore that has these deeply entrenched health institutions that really need to own up to a lot of this history.
Great. Thank you very much. Richard Rowe, what would you say is the long-term impact of COVID on the mental health care system?
I think, someone lifted up Dr. Lawrence Brown's book, The Black Butterfly. I think we can see, where he has chronicled historically and on the contemporary front what happens if we don't address injustices and equity and racial equity, health equity kinds of issues. If we allow policies, systems, practices, budgets, and to basically overwhelm us, and we not dismantle bad policies, if we don't address this whole notion of do no harm, if we don't address the dehumanization of people, if we don't address the traumatization of people, demonization of people, all of this is being lifted up during the COVID-19 pandemic. And we're seeing high levels of stress right now, high levels of anxiety, of depression, suicide ideation, suicide completion rates. So if we don't move with a sense of urgency, and if we don't basically deal with access and treatment and proper diagnosis and so forth, if these institutions are not in place to help do that, then we're going to really encounter what some of us are encountering right now, a lot of alienation, self-alienation, family alienation that leads to what? Leads to bad outcomes for everybody connected to the decimation of relationships, family relationships, and all the things that hold a people together, hold a community together. We don't really put away these, systemic racism, or address systemic racism and all of that, Dana. It's not gonna be good for us. So I'm simply saying there is the opportunity to really come together, stakeholders come together to address some of these issues. It's an opportunity for institutions like the health department and other institutions like that to really take a look at their health equity agenda plans, and et cetera. If we decide that that's what we want to do, then the outcomes can look better. But if not, I am fearful that our young people, because that's what we're concerned about too, we can already see what's happening to them in our schools, on our streets, and so forth. So if we don't really, you all, commit ourselves to really doing something different, transformational, if we don't hold institutions and policies and budgets accountable, I hate to say, but we're going to be in bad shape in years to come. So I don't want to leave you all gloom and doom, but I'm just concerned.
Well, we all feel it, and we're here. We live it. We see it. We see the numbers, and we pray every day that they stop increasing. But we can't disagree. Dr. McDow, you are quickly moving towards getting the last word because we're running a little bit out of time. But I want to ask you the same question about the long-term impact of COVID, and then I want you to conclude with, I'm trying to encapsulate or collapse the one question that we got from Brother Eddie Smith, which really what he's asking is what can we do to better target vaccine canvassing in Black and Brown communities? And I hope he'll accept that abbreviation. So Dr. McDow.
So I think the pandemic has changed a lot. I think, Mr. Rowe mentioned from the mental health aspect of things and the isolation. I do think as well that we have, on a positive note, in the response of the city, what we have seen, at least at the health department level, is Baltimore City residents and the civic duty has just been immeasurable in regards to how everyone has really stepped up to participate and be active in public health mitigation measures, masking, getting vaccinated. Our vaccination rate is in the top 3rd percentile when we look nationally at cities of similar socioeconomic demographics. That was a study that came out of Hopkins a couple of months ago. So, that's because of residents stepping up, and even, our community-based organization rapid test distribution program, where we are providing rapid test kits to CBOs across the city. The response, especially, going 3 years into this, in regards to individual citizens, to community organizations that are saying, I want to be a distribution site for the test kits, applying, like it has been very humbling to see that there is just so much community spirit, and hopefully that is something that I think it has already been like in the fabric of Baltimore, but will be even further cemented because of the pandemic. Just people stepping up and continuing to step up and do the best for their community. In regards to our outreach, I can look into that specifically. Both of those areas, our outreach from the beginning has only been focused in our low vaccination coverage neighborhoods. That map that I mentioned, and that's one of the reasons why we wanted to publicly display the map, is so that we can see not just at zip code level, but at community statistical area level, our CSA level, the neighborhood level, where we need to specifically go to focus on our outreach. And as mentioned, in certain areas of the city, Cherry Hill in particular has been a major focus of Baltimore City in terms of our vaccination outreach, and also our testing outreach as well. So we can definitely, we definitely need to continue to do that, to continue to make sure that we are following the data, and the data shows us where the vaccination coverage is low. But in those particular neighborhoods where, as our African-American neighborhoods, our immigrant neighborhoods, in those neighborhoods with low vaccination coverage, we are specifically focused on those neighborhoods. But I will definitely go back and talk with our team about that comment, because I was not made aware that that happened. But I definitely want to dig a little bit deeper and see what's going on. But both of those areas are low vaccination coverage areas.
So thank you very, very much. We're at 7:01, but there's one question that I really think I need to lift up. And please stay if you can. No pressure if you can't. But the question is, would the health department be more vocal about its historic complicity in health inequities? And I don't know that I can speak for the health department, but I can speak for my office and for my role as the city's chief equity officer. And that is exactly what we want to have happen. I'll just reach over. We all saw this in the Baltimore Sun on Sunday. We are sorry, which is the Baltimore Sun's long apology for its role. The city, obviously, I tell people we are the birthplace of redlining. That is one of our gifts to the country. There's no question about it. My 15-year-old granddaughter hopped into the car one afternoon on the way home, and she says, "Grandma, one of my professors is the grandson or the great-grandson of one of the architects of redlining." And so we had a conversation right then and right there about what that is and what that means. And, going to get her back in the car and drive around and show her, the still standing artifacts of that decision. So we all have a lot to say about what has happened in Baltimore in the name of racism and in the name of segregation and in the name of keeping people separate. So, we've talked in our office about how we can stand up, broad community conversations about race and racism, and not just, for me, it's not just to talk about where we've been, but where are we going? What are we going to do about it? I really appreciate the Baltimore Sun's article. I like that they lay out some solutions, but there's so much more that we need to do, collectively, to be better, to do better. So y'all got me started. It's at 7:04, and now I'm on fire. But so the answer is yes. Obviously we're out of time, but the one more question is, could you talk a little bit about the positive developments in the area of health equity and race? And because we're short, I think what Richard Rowe shared is just amazing. That in and of itself is one of the huge positives of how we respond to health. And so we didn't even get to touch so much on the disparities. And I know that what Coach Whitehead is doing is very much trying to bridge the fitness and nutrition gap among Black and Brown people. Little dangerous to pivot over to the historian about some of the positive developments, but Dr. Cumming, maybe you could give us like one or.
Yeah, I will say I do want to note, as the historian, you're absolutely right to mention redlining and its long-term effects, the structural determinants of health, as we all talk about. These are incredibly important. That's not to say that there haven't been positive developments. Of course there have. We see, you can look at some of the social statistics and just look at length of life, et cetera, improvements in, improvements of well-being. But one thing I just want to, really highlight is, I think one of the positive improvements is the nature of this conversation, because I don't think this conversation was happening, 10 years ago. And that's really important, especially for who we are in the city and the various positions we hold, wherever that may be. But it's also really important in recognizing the history. Again, Dr. McDow, you mentioned really how public health has been a tool for displacement, and it absolutely has, since the 1937 Health and Hygiene Ordinance that then got folded into the 1951 Baltimore Plan that was underwrote urban renewal and the Broadway project in Eastern Baltimore. There's a history here that we have to really reckon with. So I think the silver lining of that is this conversation, though, and is recognizing where we are now, and where we are now is because where we've been. And so imagining a way forward is really to take that all into account and think expansively and think in as just measures as we possibly can.
Excellent, thank you. Thank you, Keisha Ha, that's a yes. Connect with us afterwards. Dr. McDow, something positive.
Yeah, I think that as Dr. Cumming mentioned, this is the time that's right where we can have these conversations. As mentioned, the acknowledgement of the health department's being complicit in widening of health disparities and of racist acts that are impacting residents to this day. We are having those conversations at the health department. How can we acknowledge this? We last year did acknowledge it and provided that information through our social media page, through social media. But I think that this is a time where we are really have the information, one, and can act on it in a systematic manner to see how we can close how the health department can close these disparities. So as mentioned, the time is now. The leadership as well. We have someone in the health department that's leading our health department that is Black, that is a woman, that is encourages having these conversations, encourages moving this dialogue forward. So I think that's a very positive advancement. And now it really is moving towards action, and it's going to take the entire city. It's going to take all of us to do that because it is a network it's truly a network of systems that have been in place, and we have to pull those systems back. We have to pull that network. The health department is a part of that network. Our academic institutions are a part of that network. City government is a part of that network, the state, the federal. And so I think because we're having this dialogue that's intersectional, it's going to allow us to really pull those things back and be more creative and be more equitable in how we approach program development and policy making.
Thank you so much. That's very powerful. I can share my dream. The mission of the Office of Equity and Civil Rights and the mission of the Chief Equity Officer, quite simply, is to make Baltimore more equitable. I say to make Baltimore equitable, and we can do that. We have the tools where we can do the work. But like Dr. McDow said, we need to have everybody. Anytime that I speak, anytime I gather, I ask people to join us in this effort and to partner with us. And all I ask, if you can do nothing else, if you go back to wherever it is that you work, live. Hi, Diane Blevins. Thank you for being here. Diane is very active with our Mayor's Commission on Disabilities. And it's a joy to see you, Diane. But what I ask is that people go back to their jobs, go back to their employer, go back to their institution, go back to their healthcare provider and ask this: to review your policies, to review your practices, to identify those policies and practices that are inequitable and to commit to changing them. We have a tool to help you do that. That is all we ask. I don't ask for money. We could use it. I don't ask for your time. I could use that. I don't even ask for your talent. I could use it. But if you do nothing else, I ask that you go back and look at your written policies and your practices and change the ones that are inequitable. We are over time. First, I want to thank, I don't know if I thanked him at the beginning, but John Milton Wesley is the Public Information Officer for my office. Karan Watkins, who's behind the scenes, she's sending me questions and telling me that time is out. Thank you so much, Karan, for all that you do. My deputy, Caitlin Young, is on it. He's also making sure that I'm staying on point. Jill Muth and Khadijah Fairmont, they're both in law school. Khadijah is our, chief of staff. Jill is one of our investigators for the Civilian Review Board, and they're both taking exams. So we thank them for helping us get here. Coach Whitehead, Dr. Cumming, Dr. McDow, Richard Rowe, thank you so much for your time, for your talent, for your, I know that for each of you, you do what you do, not because it's lucrative, but because it's your passion. So thank you for sharing your passion with each of us. I cannot thank you enough for being here tonight. You've shared so much good information, so much valuable information. I feel like we could do, we could take a commercial break and come back for a second hour because there's so much more to chew on. There's so much more to talk about, but time is up, time is short. So let me just thank you. And I hope you'll come back and keep talking with us, as we venture along this path of information sharing and helping to make Baltimore equitable.
Thank you, Director Moore.
Thank you.
Thank you.
Thank you.
Yes. You guys are awesome. Baltimore is so lucky to have each of you. So fortunate.
Yeah.
And you.